You've probably been to the eye doctor many times in your life, and you may be familiar with several of the exams they do. But sometimes there are new tests that help you and the doctor understand your vision and how to work with it. Here's a look at several of the eye exams your doctor may perform to check your visual field. Your visual field is everything you see from side to side or up and down while you're looking straight ahead. Some eye conditions can cause a change in what you see straight ahead of you, while others can cause a change in what you see around the edges. Understanding your visual field can help your doctor know what treatment you need, and it can help you make the most of the vision that works best for you. Let's look at your central vision first, which is what you see straight ahead. Central vision also helps you see details and colors. We use it for things like reading, driving, and recognizing faces, as well as detailed work, like threading a needle. One exam that helps you and your doctor understand your central vision uses an Amsler grid. This is a simple chart that has lines drawn up and down as well as side to side to create a grid pattern, and it has a dot in the middle. To use the Amsler grid, you look at the dot, with one eye at a time, at about the distance of a reading book. As you focus on the dot to keep your eye from moving, notice if any of the lines in the grid look bent or wavy, or if they fade or disappear. Your doctor might use the Amsler grid in their office, but you can also use it on your own at home. Tape it on a door or put it on the refrigerator at eye level. Wear your glasses or contact lenses as you check each eye, holding your hand or a piece of cardboard in front of the other eye, then switch. Try this test at least once a week so you can notice any changes in how the lines look as soon as they happen. And if you do notice changes, let your doctor know right away. This helps them get you the right treatment as soon as possible, which may help preserve your vision. If you have loss in your central field of vision, be sure to check out the workshops in Hadley's Magnifiers series, along with our workshops on using your side vision in our low vision series. You'll learn a lot of great tips for making things easier to see. Now let's look at your peripheral vision. Your peripheral vision helps you see what's off to the side, or above and below your central vision. It also helps you to see in dim light and detect movement. One test your doctor does to understand your complete field of view, including your peripheral vision, is called a facial confrontational field test. For this exam, the doctor will sit directly in front of you and ask you to look straight ahead. Then they'll move one hand at a time from the side toward the center at several different angles while they're holding up fingers. They'll ask you to tell them when you can see the hand well enough to know how many fingers they're showing. This is an exam that helps your doctor decide whether to order more precise tests so they can gather more details, including the size and location of any blind spots you may have. If you discover that you're having trouble seeing things around the edges of your vision, check out our workshop on protecting yourself from bumping into things. It offers great tips on moving around safely. Another exam your doctor might use to measure your visual field is the tangent screen test. For this one, you'll focus on a dark square on the wall with a bright dot in the middle. The doctor then uses a long wand to move another bright or colored dot from the edge to the center. You'll tell them when you can see it and if there are places where it disappears. Then, the doctor marks the screen to create a map of your visual field. This can be done as part of a full eye exam. More often, it's called for when managing glaucoma, diabetic retinopathy, or retinitis pigmentosa, or after a stroke. Finally, let's look at one more type of exam that checks your field of view. The Goldman Test is similar to the tangent screen test, but instead of looking at a flat screen, you look into a curved surface, which is like the inside of a dome. Points of light appear, and you tell the doctor or press a button when you see them. This also helps your doctor map any areas of missing vision, and it's used to identify certain eye conditions like glaucoma, or to find out if a condition is changing. Being aware of any blind spots helps you to know where to sit or how to position yourself when you're talking with other people or watching something in person or on TV. It also helps you decide where to put things so you can see them better, as well as areas to scan with the vision you have to check for objects. And knowing about any blind spots overhead or toward the ground helps you know where to scan the area ahead of where you're moving. There's nothing you need to do to practice for any of these tests. When you visit your eye doctor, they'll take you through all the steps. But if you have any questions, be sure to speak up. You can always ask about the purpose of any test and when to expect results. And when you get the results, be sure to talk with your doctor about what they mean for you. Remember that Hadley's here for you too. As always, if you need more information, contact a Hadley learning expert to learn more about how to make the most of your vision.